BBC Radio Solent
with Alun Newman.
Good afternoon. It's the last hour for me, and it's going to be all teeth, all gums, all health. It's free. You can phone in now, and if we can help you, we'd love to. We have our dentist in next. Harry, it's too late. We're having the conversation. Look, it's too late. We're in up to our neck. The red light's on. Only at this point have I realised I've got you down here, Harry, as Harry Charalambous. But actually, my granddad was called Jack, yeah?
Okay.
But his actual name was Harry.
Okay, my actual name is Charalampos, but everybody calls me Harry. It's like Robert and Bob.
Okay, so you've gone for Harry instead.
Yes, please.
And your surname?
Papantonis.
Now, I was going to have a go at this, but I didn't want to start on a bad foot with you. I wanted to do really well with you, so you liked me straight away.
Okay.
I'm not sure how I've done so far.
So far, so good.
You think so?
Yep.
All right, well, welcome to the show. You are an expert dentist. You've worked with all over sort of different remits of dentistry, and that's why we're here today, as a bit of a dentistry clinic, if you will. Mm-hmm. Dentistry, before we sort of asked you some questions, was it a question for you as to whether you were going to be a doctor or a dentist? That's what I always think happens, is you get to a point where you're clearly a clever guy and you think, do I want to be a doctor or a dentist, or did you always want to do dentistry?
Yes, and I never considered doing medicine.
You didn't?
No, never.
But there's a lot of medicine in dentistry, isn't there?
Yes, there is, but it's totally different field, because you work more with your hands as well. So it's
okay.
It's not only a case of knowledge, but you have to have an artistic touch as well.
For some reason, I believe that you're trained as well to resuscitate people. Is this true? Just in case something goes wrong, is this part of the training?
Yes, and we have to do that annual. We do an annual training for emergencies.
Right.
Which, touch wood, it may happen. It's part of the game.
Is it common that someone might have a problem in the chair?
Thank God, no. The most common thing we have is fainting, and more or less that's it. But yet again, you need to be prepared for everything.
Can you spot a fainter when they walk in? Because you've been doing this a long time, do you look at them and you think, I could see straight, look at their anxiety, they're pouring with sweat, they're going to go, you sit them down straight away? Do you think you can spot one?
Most of the times, yes. You can feel it. You can see the signs. It's apparent. It's obvious.
More men than women, or women than men? What do you think? Or
more men.
Yeah, it is a man thing, isn't it?
It is. They're far more sensitive.
You think so?
Yes, they are.
Is it they're worried about because it really comes down to needles, doesn't it?
It comes, I think it's a psychological thing. It has nothing to do with needles. They just walk in and they just start feeling uncomfortable and sweating and everything.
Yeah, and then they go.
And then they go.
When they faint, do you just have to, do you roll your eyes and look at your hygienist and go, do you know, I've got such a busy day, such a lot of people waiting, and now Mr. Smith has fainted? Because I'm imagining you have to wait for him to come round and his feet will be raised, or do you cart them out and say, look, you get 8 minutes with me, now you're done?
No, unfortunately, you don't even think about this at this moment. You know that it's your responsibility and you need to sort it out. So you don't even think about time or that. You just focus on the patient.
Right, okay. But do you put a little mark on their records? I would. I'd put a mark saying weak.
Not really, but you tend to remember which patients they are. You don't forget them, but it's normal, it's common, so it's not something that we get worried or anything.
Okay.
But at this very moment, you get stressed because you need to help them.
Yeah, sure. Apparently, you know, as this is slightly off our subject for today, but as optometry, so the opticians, as they've included more tests in optometry, they've had more people faint, because they never really used to be blowing darts of air at your eyeballs and flashing red lights, and there's something about eyes and teeth and doctors where people are a little bit more anxious, and you do tend to build a sense of anxiety, don't you?
Yes, they do. Even I, when I'm on the chair, I'm anxious. It's normal.
Yeah.
It's all related to pain or experience in the past, so everybody's worried on the chair.
Yeah, it is. And then you've got the whole spaceship feeling, and then you think, and then everything looks bigger, doesn't it? A needle looks bigger when it's coming at you from that angle, do you think? Or is it a very big needle?
No, they're actually quite small, but it doesn't make any difference to the pain you feel. They've done some clinical researches. It's regardless of the diameter, how big the needle is, the patient just feels the same.
Really?
Yeah, so it's irrelevant. But for the patient to feel better, we use small, tiny needles now.
Oh, right, okay. Well, because psychologically...
Yes, indeed.
Oh, so you used to have those big monster ones, didn't you, that could sort of hit the back of your throat and you'd be standing at the window, and they really made you nervous. So,
yes.
And it's just a psychological thing. They've changed the size of needles in dentistry just to make the client feel more comfortable.
Yes, I believe so.
Oh, okay. I didn't know that. And so you've been a dentist for how long?
Since 2005.
2005. Okay, Harry. And you're based at the Ferry Dental Centre in Ocean Village.
Yes, we do.
In Southampton. You enjoy it there?
Yes, we love it there. It's very nice.
It sounds quite classy. Have you got a nice BM that you park outside? A huge BMW that you waft away in every day?
Not at the moment. I currently drive a Ford Fiesta 2002.
Oh dear.
But I just sold my car a week ago, so that's a temporary thing.
Oh, is it? It's your standing car. Yeah. So you feel like a man of the people. You're thinking, crikey, how do people live with this thing? This is awful. What are you changing to? Something posh?
No, I don't know yet. Probably not something posh.
Not something like an Aston Martin or something?
It's a myth that we make that much money.
Is it?
Yes.
No. Don't burst the bubble, Harry. No one wants to go to a poor dentist. We all want our dentist to be doing well.
I never said we are poor, but we are not the multimillionaires.
Okay, not like pilots.
I think that's a myth as well.
Okay. Right, we're going to break for a bit of music and then I'm going to fire lots of questions at you. If you want to get a question to Harry, there's nothing he can't answer when it comes to teeth and dental care and all that kind of stuff. The text is open as per normal, 81333 in the first word, Solent. Phone lines are open, emails open. Throw us your best shot. We'll see if we can stump him. Lots of questions ready to go. Before that, the Stereophonics. Stereophonics on BBC Radio Solent, having a great chat here about veneers. But before that, Julian is in Poole. Julian, welcome to the show.
Hi, Alan.
Thanks for giving us a call. We've got the fabulous dentist here from the Ferry Dental Centre in Ocean Village. Harry's here. That's just one of his names he uses for ease for his clients, I think, because he's fed up with British people messing it up every time. Right, how can we help you?
Right, my question is on behalf of my wife. She's got lovely teeth. They're all even, they look really nice, but unfortunately she's got gum disease. And we were told by the dentist some time ago that there was no cure for this, and I just wondered if Harry's got any advice on that.
Right, Harry, the floor's yours. Hit them.
Yes, there is. It is treatable. All you need to do is see a dentist to initiate the treatment, so clean the teeth, and then you have to brush very, very nicely. The problem with gum disease is that the dentist only starts the treatment, and then you have to brush very, very nicely, and this is how you treat yourself.
So, Julian, how come... Oh, who was that? Is that you or me? That's your headphones. Move in a little bit, and that's it. How come the dentist has said that your wife's gum disease isn't treatable, yet our dentist in here is saying that it is treatable?
Well, I've got no idea, but that's what he said. He said that quite some time ago, and I just wondered why there wasn't any particular treatment. All he advised us to do was to get some particular toothpaste and a mouthwash, and he said that basically it would be just a question of slowing the process down, but basically there was no actual cure.
Okay, so maybe, Harry, the thing is that gum disease has set in once it's got going and gum disease is rolling, so maybe they come to you and it's already a problem. Is it then a bigger problem because you can't slow the process down, or is it still the same as you've said? You've got to get your... You
can slow the process down. It all has to do with treatment. It's true that the gum will never get up again on the tooth, and the bone that has gone, it will never regrow there. But there are surgical procedures where you can help and stabilize the teeth, and the gum again, it can be moved upwards a little bit.
Can it?
Yes, with surgical operation.
That sounds painful.
But most of the times, maintenance is more than enough. Cleaning, brushing, and then you just make the patient stable, and then they stay like this.
Right, Harry says, okay, Julian, that it's treatable. Maybe you should change your dentist.
Well, in actual fact, we are in the process of changing our dentist anyway, so I think that's going to be the first question that we ask the new dentist. Yeah,
good question, though. Thank you for that, Julian.
Thank you, Alan. Thank you, Harry.
Take care. Bye-bye.
Bye.
So that's Julian in Poole there, which looks like he's going to get rid of his dentist. Right, some other questions, Harry. You ready?
Yes.
Okay. But one of the questions we got here was can you brush your gums away and they don't grow back? But you've kind of answered that. The answer is yes.
Yes. This happens when you overbrush, when you apply too much pressure, and when you brush with horizontal movement on the gum.
Okay, so when you're going backwards and forwards horizontally, it's bad for your teeth.
Very, very bad.
This is how everyone in Britain trains their children.
Not anymore.
You think so?
I hope so.
Yeah, okay, so it should be from the bottom up.
Yes, it should be, if we say to the children, from the red to white, so from the gum towards the tooth. And you use YouTube for lots of other things. You can actually Google how you're supposed to brush your teeth and watch some very nice educative videos how to do that correctly.
Now, most of our audience will be older. They're not going to be children listening to this. So if they have damaged their gums and they've brushed loads away, tell me about what you can do to help that.
We can advise the patient to invest into an electric toothbrush that has an overpressure indicator, so that you know when you're pressing too hard, it just flashes red on your eyes. And the second thing to do is to see a dentist and see how much damage is done and how we can sort it out. There is always a way to help patients.
Okay. And your take is there's usually always something that can be done to help people when they come in and see. If your dentist is any good, he should have a solution for you.
Yes, there is always a way.
Okay, another question. This is about whiter toothpaste. Do the toothpastes that make your teeth whiter work?
I don't believe so. I have never seen any evidence, and the amount, the strength that they're allowed to sell, it's not strong enough to make any real difference on your teeth.
Okay, so
it doesn't work.
Oh, okay. Oh, fair enough.
According to me, it doesn't work. There are some elements inside that will make your teeth slightly whiter, but you will never notice nothing like a dental whitening.
Okay, and dental whitening uses bleach, does it?
Yes, it's peroxide. It's kind of like bleach.
Do we like that? Do you like that as dentists, or do you just think, brush your teeth well, and then you won't have to do this?
I've done it to myself. I do it to lots of patients, and it looks amazing. Everybody likes it, and it's not harmful.
Is it not?
No.
What, putting peroxide on your teeth isn't harmful? It's
diluted, so it's very weak. Actually, it doesn't cause any damage on the teeth. If it's done correctly, it will not. It doesn't have any problems.
Everyone's teeth are different colour whites. Is that true? It's like some people can have a different shade, can't they?
Yes.
So when you peroxide a tooth, does it go back to its original colour rather than just a super white?
Yes, it goes gradually back to its original color. We don't paint the teeth, we just remove all the staining.
Okay, I did see some kits. You can buy bleach your own teeth kits online, can't you?
Yes, and this is very, very dangerous. I wouldn't touch any of that.
Yeah, I think you've got to be some kind of special guy to bleach your own teeth.
You must be very naive.
Yeah, I think so, to be bleaching your teeth. Okay, we're coming up for the weather and travel. I've got another one to ask you just before. It's about does sensitive toothpaste work? And I'm going to add to that I had a quick look online. And you know the toothpastes that are famous for, they always have a dentist like yourself with them, with a great tan, a nice smile, and you tell us all that you endorse this toothpaste because it's amazing. You know, look at Janet. She couldn't eat ice cream, but now, thanks to this, she can. Do they really work? And I heard that you only actually need a tiny little bit of toothpaste rubbed on the tooth that's sensitive, and that will do for a week.
Yes and no. Yes, sensitive toothpastes work. They work nicely, but you need to have very nicely brushed teeth first, and then they do help. Long run and short term. And rubbing the toothpaste, there are a few toothpastes that do help if you rub them. You must be careful not to do this constantly. You can only do it for a week or 10 days because you may cause damage if you do that all the time. If the sensitivity, the hypersensitivity doesn't go after about a week, then you need to see a dentist. There is something more serious there.
Okay, so with that in mind then, if you are a regular user of a sensitive toothpaste, are you undoing some of the good work because you're using it all the time? Should that be something that you use once a week rather than every single day?
No, you can use it every day. I'm saying about applying it directly onto the tooth. This shouldn't be done daily or every day, actually, every night.
Okay, because the concentration's too strong.
It's too strong, yes.
In the TV advert, there's a graphic of the enamel becoming harder. Is that possible?
It is, yes. It feeds the enamel, it makes it stronger. And it actually seals the nerves, so you don't feel the cold or the hot that much.
Okay, and does not all toothpaste make the enamel harder?
All of them do, some more, some less.
Okay, all right. Stay there, don't go away. It's a dental clinic special here on BBC Radio Solent. Alun Newman standing in for Sasha Twining. Sasha back on Monday. She's got a well-earned week's holiday before she embarks on another run, taking us all the way through to Christmas, I'm sure. Harry is here from the Ferry Dental Centre in Ocean Village. We've been talking about... let's talk about the question we had about cosmetic surgery. The actual question was the cost of cosmetic surgery. How much does it cost per tooth? But I guess that's a ridiculous question because you need to see the face and work out what needs to be done. But cosmetic surgery is more affordable, I guess, because you can get that on a monthly basis, however you want to go about doing it. My experience of cosmetic surgery is a friend of mine never used to smile in a photo, got his teeth done with some kind of porcelain veneer, would that be right?
Mm-hmm, indeed.
And it changed his life. It really did. He smiled, he felt more relaxed. It was really important to him. For me, I didn't even notice, but he needed it done. And I guess what you're seeing is clients coming in and they're saying, I just don't want to live with this anymore. I'd like to be more relaxed, more confident. Is that correct?
It has to do with confidence. Most patients walk in and they say, please help me improve my smile. I don't feel confident enough. And these are the brave ones that admit it, because most people walk in and they just want it improved and they don't say that, I don't like it.
Okay.
And it's amazing, really, when you see their facial expression at the end, when you fit the work and they're happy and they smile and you can see that they're happy, they're satisfied. It's a very nice feeling. You feel nice as a professional.
And the process is you take a normal set of teeth that the person's not happy with, you agree which ones you're going to do, which I guess is most of them, and then you grind that tooth back. Is that right?
Yes.
And you stick the veneer on top. I don't know what I'm talking about. You take it away.
Depends if you are going to do veneers or crowns. Depends on the clinical situation that you have to play with. Most of the times, though, it includes veneers or crowns. So yes, indeed, we remove a small part of the tooth, but we're talking about millimeters, nothing more. So it's a very, very, very small, tiny amount of tooth is being removed, and then you stick on top a piece of porcelain, and it looks amazing. It looks very natural.
And as a dentist, I often wonder the great sort of envious American smile, British people's. You can tell that Ricky Gervais said about The Office. He said the American office was the same as ours, except with better teeth. As a dentist, can you spot when someone has the veneers on their teeth straight away? Can you tell?
Most of the times, yes, and this is most of the times the patient's fault. Patients ask for super white and perfectly aligned teeth. We try to convince them that it will not look nice, it will not look natural, but most of the times we argue with them, because they want them perfectly white. They want the whitest, and they want them perfectly aligned, so it doesn't look nice. It's not natural.
Okay, so the goal is to really create perfect veneers.
The goal is to make it look as natural as possible, and most of the times this includes making it not perfectly aligned. You leave it a little bit to look natural.
Okay, so that's quite a tricky thing, isn't it? Because if I came into you and I said, right, I'm going to go for it, I want to spend 20 grand on the perfect set of teeth, and in my head I'm thinking Tom Cruise, I'm thinking film star, and then you say, great, okay, well, shall we have one that's slightly shorter here? And
no, you don't do it shorter. You do it normal, but within the normal there is a margin where the eye will accept as natural and yet again straight, but not perfectly aligned.
Okay. When you have the cosmetic surgery done, is it a case of I come into you and we agree it, we come up with a plan, you then take some moulds of my teeth or something like that, get the veneers ready, and do I walk in with these teeth that I'm not very happy with and walk out with a complete set of fantastic veneers on? Or is it like surgery, you have a couple done, then you have to come back a week later, another couple?
No, we do them in one go because we can achieve a better result like this. So it's all done in 2 appointments, actually. One appointment we do the preparation of the teeth, we take the impressions, the molds, and then you come after a week or 10 days and you walk out with a perfect smile.
That is pretty cool. Is that what is it nice seeing the reaction of people when they look in the mirror for the first time? Do you see them?
Yes, you can see in their eyes, deep in their eyes, you can see their satisfaction and you feel nice.
And if they've always hidden their smile, do they find it hard to smile because their brains have kind of trained them to be anxious?
It takes time for the patient to relax again and start smiling. The wide smile where you show your teeth. It takes a few weeks, sometimes takes months for the patient to to build up the confidence that he can smile.
Yes, because if you've been anxious from school, that could be 20, 30, 40 years of having a smile that you've been a bit embarrassed of for whatever reasons. You didn't have to be, but you kind of chose to be. Take me through the cost. Because I know you're going to panic a little bit, but broad brushstrokes, how much would it cost for me to get a showbiz smile?
Most of the times we do the upper 6 or 8 teeth, and it costs roughly £800 per tooth.
Okay.
So it's not that expensive.
That's not too bad, is it?
Let's say it's about £5,000. You can do it interest-free. It's £400 per month for a year. No, I'm going to say that what you get, your confidence, it's not that expensive. It's not £20,000-30,000.
A lot more adults in braces these days. Is that because they're cheaper? And you've got braces on.
I do, yes.
Did you? I bet your mate fitted those, though, didn't they? But you take it in turns. You do my braces, I'll do yours.
No, it's just one of my teeth. One of my teeth wasn't perfectly aligned, and I'm just making them more aligned.
Okay. Well, you're a dentist. I mean, you are the showcase for your work, aren't you?
I've always wanted.
But braces are more popular. I see more adults with braces. Why do we see that?
Because now we can do it quickly. We can do it within up to 6 months. And we can also do it with white braces, which are not very visible, and it's becoming more and more popular.
Okay. What about the teeth you screw into your jawbone?
The implants, yes.
Yeah, are they more popular? Because I saw an advert on a tube for one of those. It said, get these new implants. I thought, crikey, who would be tempted by this? But I guess there's something new out there. But I thought they were for emergency work.
No, if you have lost your upper front tooth, for example, an implant is a very, very nice solution because it's the most natural way of restoring missing teeth.
Right. How long does a veneer last, a nice posh porcelain veneer?
The veneer as a material is supposed to last forever. The problem is the gum that may recede in the future, and then you will have your the margin between the veneer and the root of the tooth will become visible, and this is where you need to replace it. But most of the times they last for a long time, at least 10-15 years, without needing any maintenance.
So if I was particularly careful with my maintenance, I could get that veneer to last longer. But I guess if I don't, I come into you and you whip them off and put different ones on, do you?
Yes, you just remove it and you file a little bit more of the exposed part of the tooth, and then you place a new veneer. But we have seen veneers that are 20 years old and they still look amazing.
Okay. A couple of other questions. Your dental hygiene, is it hereditary? So if your parents suffered from your teeth getting soft, I don't know what a dental problem might be, but let's say my dad has soft teeth. Is that even a condition? Is it hereditary?
Kind of, but that's a small percentage. So let's say this is 20-30%. The remaining has to do with brushing and oral hygiene and diet. Okay.
Chewing gum. Is it good to chew gum? Question here. Is it healthy and good to chew gum?
It is because it stimulates the saliva. And that's it. So you get more water, more saliva in your mouth, and it reduces the amount of food, let's say, that it's left in your mouth. So it is good, but don't expect miracles. It will not prevent the decay if you don't brush and you only chew chewing gums.
No one wants to hear the dentist say you've got to put effort in. We're after quick and easy solutions.
Unfortunately, 80% has to do with brushing, mechanical cleaning.
Nobody wants to hear that. We want a miracle pill that does it all for us. That's the way the world's going. Right, one more tune, then the last few questions.
BBC Radio Solent.
You're listening to BBC Radio Solent. Of course, Alex Dyke is warming up on his Pilates ball, nearly ready to go. The last bit of our expert dentist, Harry's in the studio from the Ferry Dental Centre. We've had a great time. I've tried to schmooze him in order to get cheap and free dental care, but it hasn't worked. But don't worry, we've got the last link to go. It might go quite well. Harry, just a quick one. We haven't discussed this prior, but coffee or tea, which stains your teeth worse?
Both, but if you brush afterwards, then you can have as much coffee as you want.
Yeah, but no one brushes after a coffee, do they? Even you don't brush after a coffee.
I try to add, I love coffee, tea, red wine, and I try to add a couple of more brushings per day, so I don't brush twice, but I brush 4 times per day. And with often cleaning, then your teeth look nice and white.
So chewing gum after coffee would help?
It will increase. Again, we get back to the other one. It will increase the saliva. And
it's hard work. What about those ball-shaped things you buy at service stations? Have you seen those?
I have seen them.
Where you put the quid in and you can. They brush your teeth for you.
Yes, I've used it once, and okay, as an emergency choice, it's okay, but it's not a proper brushing.
No, and it's also embarrassing to get them, isn't it? You know, you're in a massive convenience in a service station, and there they always are. And I think I don't want to be standing here looking for change in my pocket. But it's awful enough even being in here, let alone trying to buy a toothbrush ball thing that cleans for you. Question here. I'm going to read this, then hide. This is from Kerry. He has partial dentures. His top set are making him gag because apparently he has a high palate. What should he do? I'm going to cover my ears.
He can have this denture adjusted so that it will be shorter and it will not be as close to his throat. Or he can have a new pair of a new denture done, which will have a different design so that it will avoid the areas where he gags. Or worst case scenario, he can just throw away the partial denture and have some implants to restore his missing teeth.
Yeah.
So there are options out there.
There are options, so you can get that changed. Are electric toothbrushes better? My dentist said to me.
Yes.
Right, now you've said electric toothbrushes are a good idea. Well, kind of, but my dentist said, bad idea for children. They need to learn to brush their teeth properly. Otherwise, they just get dependent on and they move from tooth to tooth. They're not learning a habit of gum to, what do you say it was called? Gum to tooth. Gum to tooth, yeah. He's not a fan of them.
I totally disagree. You can prove it yourself. You can buy these tablets. They call disclosing tablets.
Sure, Topsy and Tim had them in the 1960s, yeah.
We still give them to our patients and we encourage them to buy. And you can use manual toothbrush, chew the tablet. After a week, do the same with electric toothbrush, chew the tablet, and you can see the difference yourself. I believe they are much faster, and this makes them much better.
Really?
Yes, because
I love my dentist. I mean, he can do no wrong in my eyes.
Give it a try yourself. You don't have to question anybody. Just try it. The disclosing tablets, they cost £2 for 20 tablets.
But it's a bit lazy, isn't it? If you've got a brush that's oscillating at 1,200 oscillations a minute or whatever, and life's busy, and you're sticking that tooth to tooth, are you not risking rubbing away your gums, which you said was a big problem?
Most new electric toothbrushes have an overpressure indicator, so they flash or they beep when you're applying too much pressure. So it's actually not only worse, but it's better because it helps you prevent wearing out your teeth.
Do you have one?
Yes.
I mean, I grant you, when you've used one, they feel awesome, don't they?
There is a massive difference.
Yeah.
I couldn't do it with a manual toothbrush.
No. Or maybe I'll change then.
Give it a try. You have nothing to lose.
Okay, but it's a quality one, not one that you're going to get from a cheap store. You need a decent one that's got indicators on it and all the rest of it.
All you need to do is to have this indicator, and they cost £35. You don't have to give £200.
No, of course. Finally, grinding my teeth. What can I do about it? I've got a plate, but it doesn't make any difference.
You need a night guard, which is an appliance that will prevent your teeth from touching when you sleep, and this will relax the muscles and will protect the teeth from getting worn off. But if you are still worried, I advise you to see your dentist. Maybe you need to be referred to see a specialist in the hospital and do some further tests and examinations.
Can you? What do you see if I was sat in the chair and I opened my mouth and you looked in? Could you see if I was grinding my teeth?
Yes, you can see worn out teeth. So the tip is missing of the tooth.
Oh, okay. And at that point, either go and see your doctor or dentist, whatever, if you think it's a psychological thing, stressed at work or whatever. But you should do something straight away by getting something in your mouth at night to stop you doing it.
Yes, it's important. You shouldn't leave that. It will only get worse and worse.
Okay. I wasn't going to ask you this, but it's just sprung to mind. You know that when a whole family come in to see you, yeah, mum and dad, 3 kids, can you see if they've quickly brushed their teeth before they've come in?
Yes, it shows.
How do you know?
It shows because you can see old plaque, new plaque. You can see if they've been brushing nicely since their last checkup, or they only brushed nicely the last couple of days. It shows.
But what about if they've literally just... Because with my kids, I say to them, look, quick, we're going to brush our teeth now before we go and see the dentist. They have great teeth, don't get me wrong. And he always knows... He goes, you've all brushed your teeth before you've come in. I'm thinking, how does he know this? Does it leave a mark on the gum when you brush your teeth?
No, it doesn't leave a mark, but you can see... Do you mean if you have just brushed your teeth?
Yeah. Just like 20 minutes before. He's like, oh, God. Is there a secret? I wonder if there was a secret I could cheat him.
No, I can make the difference if you've been brushing nicely for the past 6 months, or you just brushed nicely an hour ago, but I cannot say if you have just brushed your teeth. Sorry, that's a secret your dentist only knows.
I think what it is, he looks out the window and sees us all running in late and then thinks, where have they all gone? And we've all dipped into the loo, and then there's an amazing smell of mint suddenly radiating.
Possibly he can smell it.
Well, we've run out of time. It's been lovely to have you in the studio, Harry. Thank you for fielding all these questions. Nothing seems to faze you at all. I wouldn't have made a great dentist. You just seem to sort of take it in your stride. There's nothing at all. People come in with teeth missing and they haven't looked after themselves. You mentioned that one of the things you find frustrating, a little bit frustrating, is that people feel a bit embarrassed to come in.
Yes, unfortunately, we get it a lot where people call us or email us and ask that I haven't been to the dentist for a long time and I feel really embarrassed. Can I come? And it's a very weird question because if you don't ask for help, you will never improve it. So the dentist is the first person you need to visit to improve the appearance or the pain or whatever is your problem.
I guess when you've done 3 or 4 years of not coming in, there is a sense of, I haven't been for ages, that I'm going to get criticised.
Yes, you will not get criticized, but how else? There is no other way. That's one way. It's a matter of time that you will need to see a dentist. You cannot help yourself otherwise.
Yeah, okay. For your own teeth, do you lie in the chair yourself?
Yes.
You do? You have a look yourself at your own teeth?
No. Another dentist
You
does.
just get one of your mates to do it. You say, I've got a bit of sensitivity back here.
It's very weird. My wife is a dentist as well. Unfortunately, she does my teeth. So, not good.
Did she do your brace?
Kind of, yes.
This is so unfair for the rest of us, isn't it? I mean, you've got a dream ticket here. 2 dentists in the family. That's amazing.
Not very interested at home, though. It's a boring dinner time.
yeah. You're not both at the same practice, are you?
No, thank God.
That would be good. That would drive you around the bend, wouldn't it? Harry, from the Ferry Dental Centre in Ocean Village, lovely to have you on the show. You've been a delight. Have a good rest of your week.
Thank you very much.